we've all been trained, or most of us have been trained, in what I call I-thou models, meaning the client says I and we say you. All of us were trained. I mean, my psychodynamic training, I was not trained to see fragmentation. I was certainly trained to take a history to see the client in the light of that history. I learned as I got more and more into my graduate program, I learned to diagnose, to use the DSM. And I certainly in my hospital internship, I was trained to see unsafe behavior as a problem. It would never occur to anybody to see unsafe behavior as an attempt at a solution. And to become fluent in TIST and consistent in using it changes a lot of those therapeutic habits, right? It's we have to learn to practice therapy in a different way. And rather than having to think, what should I do? It's so much easier when it's automatic and just natural. That requires practice and coaching. And so that's what the certification training is all about, is the opportunity for coaching and practicing until you get TIST more in your bones. Now, as we get those skills more in our bones and they become more nuanced and they flow more easily, it's actually more fun to be a trauma therapist. And that's another thing that I love about TIST is that it's more fun to be a trauma therapist. Your ability to track the parts becomes better and better with practice, especially that combination of practice and coaching. And you're much more creative if you're not constantly thinking, what am I supposed to do next? Let me tell you how certification training works. Each TIS3 student signs up for a practice group, a group of six participants who meet 6 times with the help of a senior TIST facilitator. I have this amazing group of senior facilitators. They are trusted colleagues with whom I've worked with for many, many years. Many of them have been in supervision with me. We have shared cases. We have a long history. I think the shortest relationship I have with any of the senior facilitators is 10 years. So that gives you an idea. And at each meeting, your group of 6 will meet for 2 hours. And in those sessions, you will be asked to practice 1 or 2 particular skills using your fellow group members as clients. And the facilitator has a chance to coach you and mentor you. Alternating with those group meetings, we have live sessions that hopefully, my intention is, that help to support those certification sessions. I'll talk more about the skills of the week. You'll have a chance to ask your clinical questions about applying TIST because the practice groups are focused on skills practice and using TIST in a mock session. There really isn't time to ask case questions. Now, the wonderful thing about getting certified, first of all, there's the satisfaction that comes from honing your skills and reaching that milestone. But also, you become part of a literally worldwide community of certified TIST therapists. I've forgotten now the total number we have. I still feel as if we want, I know that we want a bigger and bigger community, but it's impressive how many certified TIST therapists. There already are. You can list your certification on your website as a professional credential, and you will also get a special sort of medallion on your TIST therapist in the TIST therapist directory. So the certified TIST therapists come up first, and they have this very not dramatic is a maybe overly dramatic word, but a very impressive sort of medal of honor on them. Unlike some training programs, TIST certification is meant to demonstrate the basic skills. It's not asking you to be excellent. It's asking you to be able to deliver the model.